Expressive Arts Therapy. This is adapted from an article reviewed by Psychology Today staff. Expressive Arts Therapy combines psychology and the creative process to promote emotional growth and healing. This multi-arts or intermodal approach to psychotherapy and counseling uses our inborn desire to create. Such a therapeutic tool can help initiate change. For some people who have a hard time articulating what they are feeling, self-expression through art can be useful. Expressive Arts Therapy draws from a variety of art forms, and this integration of methods can help patients access their emotions. Meanwhile, art therapy tends to be based on one particular art form. Expressive Arts Therapy has been studied in nursing care settings and can be an effective modality for patients. It can be used for individuals or in groups to nurture deep personal growth and transformation. For instance, expressive arts therapy for children with behavioral issues might include music, movement, or finger painting. This type of therapy can be especially useful for children who may not have been able to vocalize what they feel. The therapist observes the child's behavior and impulses and then encourages the child to talk about the experience. Journaling, storytelling, reading literature and poetry, as well as making life maps, videos, and memory books, are all forms of expressive art therapy. They can help more mature clients review and make meaning of their lives, and this is a way to tell their life stories, as well as through and heal from traumatic experiences. It also helps patients better engage with family and other significant people in their lives. Here are some of the many forms of expressive art: playing music, listening to music, writing lyrics, theater or improvisation, reading or writing poetry, journaling, reading fiction, drawing, painting or finger painting, and sculpting. What to expect? Expressive arts therapy can be accomplished via the creation of different art forms. The commonality is the use of multiple senses to explore your inner and outer worlds. A therapist or counselor helps you communicate feelings about the process and accomplishment of making art, and together you use the creative process to highlight and analyze problems and difficulties. The therapeutic work is based on the creative process, not the final result. Therefore, it's not necessary to have experience, but to explore new and different ways to use the mostly non-verbal language of creativity to communicate inner feelings that were not previously available to you by simply thinking or talking about them. How it works. At the core of expressive arts therapy is the concept of poiesis, the Greek root word for poetry, which refers to the natural process of moving from everyday expectations into the world of imagination and creativity that results in art making. Art comes from a deep emotional place within you, hence creative endeavors will enable you to undergo a profound process of self-discovery and understanding. Creativity becomes the pathway to the expression of inner feelings, leading to a process of self-discovery and understanding. Your creative process becomes your road to emotional health. Many therapists also incorporate other modalities such as cognitive behavioral or mindfulness-based cognitive therapies. What to look for in an expressive arts therapist. Screen your potential therapist either in person or over video or phone. During this initial introduction, ask the therapist how they may help with your particular concerns. Have they dealt with this type of problem before? What is their process? And what is the treatment timeline? With certain trainings, mental health professionals can be registered with various institutions. There's normally a minimum requirement of a master's degree in expressive arts therapy, psychology, fine arts education, or a related background. And depending on one's educational background, there's supervised clinical work and advanced training, along with references and other requirements. Check with your insurance carrier for coverage of this type of therapy.